Dr. Staci Blume, welcome to the Urban Pharmacy Podcast, my dear friend.
Thank you. Thank you. Excited to be here. I was glad you asked me and finally found a time to get it on the schedule because I know we're both a little busy.
Just a little bit. So let's talk about that. Let's talk about your life and you, because you are an incredible human being. People need to know you. So, tell us about yourself. Tell us about what you do and also why you do what you do.
Well, I'm a chiropractor. I've been in practice for 14 years. I had my first practice in North Dakota, was there for 10, moved to Indiana, and I've had a practice here, Life Refined Chiropractic, for 4 years, little over 4 years. So that's what I do professionally. Like, I see patients every single day, take care of people's nervous systems and enhance their health and their life through chiropractic, but also a bunch of different services. My husband and I just opened another company. It's actually connected to our office, called Well Infused, where we have a team of functional medicine doctors, nurse practitioners. We're doing IV nutrition and hormone therapy. So essentially all of the self-care things that I want, I just surround myself with and hire people to do, because I want to give my clients the same services that I would want to utilize myself. So people often ask, how do you decide what services to offer or what to include or what to hire? Basically, any service that I want personally is what I kind of add to the repertoire. And it's been a lot of fun to find those like-minded people to take over. I don't do acupuncture, but I have an amazing doctor of acupuncture in my office. And I have amazing nurse practitioners and functional medicine doctors, which really allows me to do what I do best, which is take care of people through chiropractic. So, have my practice with my husband. He's been a chiropractor for 20 years. This is also his second location, and we'll be opening up additional offices for the Well Infused business with other friends who are chiropractors and want to add these services with a model that's really working well. So it gets me into the chiropractic piece, but also the health and wellness piece, but also the entrepreneurial space, which I find pretty exciting as well.
I love it. Oh my gosh, so good. Okay, so go back to where you first got into, why do you do what you do?
Why chiropractic?
Yeah.
So I started off going to undergrad with the intent of doing physical therapy. And my idea of what physical therapy would be and what it really is were very different. It's a great career field. It was just not for me. And so then I decided, well, I think I'll go to medical school. I really want to help people enhance their health and enhance their lives. And I was interested in science, and I found that really interesting. I went all through school, got my pre-med, took my MCAT, was accepted to medical school. And then I took a year off. My great-grandmother, whom I was very close with, was not doing well. And I moved back home to be near her for that year. And over the course of that year, ended up taking a job at the front desk in a family medicine office, just answering the phones and scheduling and checking people in and checking people out. And I have like this knack for organization. Like, I like systems, I like efficiency, I like things to run smoothly. And so they ended up moving me to almost every department within the hospital. So I worked in neurosurgery for a period of time, which was really fun. I worked in every department you can think of. They kept moving me around to help create these systems and procedures in every different practice, ENT, you name it. And by the time I was done with that year and rotating through all of these different specialties, which I thought was going to help me pick a specialty before getting to medical school, what I realized is that all they did all day is people came in sick and unhealthy and unhappy, and they got this prescription and they left, and they came back like a month later, still sick, still unhealthy, still unhappy, but they got another prescription. And I was flabbergasted that my idea of health and the reason that I wanted to go to medical school was not at all what medicine was. Like, that was not their goal. Their goal is to put out fires, to cut things out when they look big, bad, and ugly, and to get rid of symptoms using chemical override. And that is not what I was put on this planet to do. So in that year, I'd seen a chiropractor since high school. And in that course of that year, I was like, wow, why didn't chiropractic occur to me as a career path sooner? And apparently it was because I was supposed to have that experience first, of that awakening and realizing that what most people look for when it comes to enhancing their health, they're actually utilizing services that only minimize their symptoms. They're not actually getting healthier. They're just they're basically dumbing down the system with chemicals. And so when I started to look into different types of chiropractic, one of them being, there's a subset of chiropractors who really just focus on neck pain and back pain. Well, that's great and wonderful. That's not what thrills me. Well, we see patients for that every single day. What I love to see is people's health status change. For me to check in on my teenagers, I call their parents and say, hey, how are they doing? They don't really give me much feedback in the office. And parents tell me, I don't know how they're feeling, but I can tell you I have a happier child because they get chiropractic care. I have people who come in here every single day that have gotten off of blood pressure medication because of chiropractic, that have changed their nutritional habits because of what we teach. We have functional medicine doctors who will help them customize nutritional plans and nutritional recommendations. And I have men who come in grateful that their wives are getting hormone therapy and they feel like they have their human back. And so that's what I love about what I do, is that it's actually enhancing people's health and lives and not just minimizing symptoms. So we get to, it's fun. It's enjoyable every single day. We have this big open space where people come in, they get to meet other like-minded people, and it just creates this amazing subset community that is the type of people I want to spend my time around.
I love that. I think you seriously understand, first off, your purpose. And so many people, and what I try to encourage women to do every day is to not dummy down that voice, or the nudge or the gut feeling or whatever, however it's coming to them. Like, those dreams and those thoughts are there for a purpose. And it's our job to step into them, even though it's like super uncomfortable. And it might be something totally different than what we had planned on doing. Like, you took a full 360 and went the other way.
Yeah.
But I love that story. I didn't actually know that about you. And that's why you got into chiropractic, because you saw the system on the other side. And that is incredibly powerful. And now you're like an incredible healer, and you live and breathe this lifestyle, this holistic lifestyle that is incredibly powerful and healing. So let's get a little bit more into the healing benefits of chiropractic, because I don't think that enough people know about chiropractic in general. So
most people just kind of think of it like neck pain, headaches, back pain. But really what chiropractic is, and it's really simple. All chiropractic does is helps the brain better communicate with the body and tell it how to work. So for example, if there's pressure on the nerves that go to your stomach, you're going to have indigestion or acid reflux or constipation or stomach cramps or who knows what symptom. But that's because the brain can't tell the stomach how to work properly, or vice versa. The stomach's not giving proper feedback to the brain. And you can give that example for absolutely anything going wrong in the body. We know that pressure on the first nerve in the neck, if that's found to be present, if you remove that pressure, is more effective on managing blood pressure than any two blood pressure medications combined. So if medical doctors just knew, okay, before I give a blood pressure medication, send them to a chiropractor and see if there's pressure on the nerve that controls blood pressure. The number of medications that we would see in this country had 10%. If we reduce it by 10%, that's huge. But I bet blood pressure medications make up more than 10% of the medications used. I haven't done the research because I go by my feelings and my analysis in the office and not by research. I don't have time to read research. But so that's all chiropractic is. How do we make the brain and the body communicate more clearly so a person's health can thrive? It's as simple as that.
I love it. And speaking of blood pressure, you combine chiropractic care with some strong hibiscus tea every day. Hibiscus tea is stronger than any blood pressure medicine out there too. So there's 2 tips for you.
There we
have
go.
High blood pressure, I can talk high blood pressure. I get so energized when I talk to you, Staci. Sorry, I can't get without. There you go. There you go. Okay. So talk to your doctor before you try to get off any medications, but also talk to your chiropractor. Your chiropractor and go get some tea.
Yes.
Okay. So can you talk about the vagus nerve a little bit and
vagus nerve? Yep.
Yeah. The importance of it. What is it? And why does it matter to everyone?
Right. Well, it's one of the cranial nerves. So it's one of the ways the brain communicates with the body, but the vagus nerve is highly responsible for anything parasympathetic happening in your system. So the sympathetic part of your nervous system is fight or flight. If you're in pain, If you're highly stressed, quite frankly, 90% of Americans run in sympathetic overdrive. Their life is too busy. They don't take enough time to recharge and recoup, and they're constantly in that go mode, almost like their car's in park, but they've got their foot on the gas and they can't figure out why they're not getting anywhere. The other part of the nervous system is parasympathetic, resting, repairing, digestion, mood stabilizing. It's also good for proper sleep cycles and hormone cycles. And so it's regulatory of all of the automatic things that happen in your body. And so because as people living in America right now have more sympathetic stimuli than parasympathetic, being able to regulate that parasympathetic part of the nervous system is really important. And that's largely done through the vagus nerve. So a lot of people will wear that Oura ring and can measure their heart rate variability through that. It's a great tool if you're using it consistently, just to kind of see trends. In our office, for every new client, but also for every progress assessment, which we typically do quarterly with our clients, we do a very detailed, in-depth heart rate variability test. It helps us know how well their body's healing and repairing. So if I do a heart rate variability test and find that their autonomic energy is 50%, well, this person has no hope of healing and repairing at 50%. They've got enough energy to like carry on normal daily activities, but nothing left over for repair work. I have to figure out how can we change lifestyle habits to get that autonomic activity back up so their body can get into a healing mode again. Beyond the activity level, we can measure sympathetic versus parasympathetic balance. A perfect score of 100, meaning you can dip into either of those systems as your environment requires, is perfect. But most people are stressed. Like I see people, you can go to 0 all the way on that sympathetic side. And I see people in the 30s and the 40s all the time because they're taking on more in their life than they can handle. They're not doing enough good things for healing and repair. Nutrition plays a part in it. Sleep plays a part in it. But that testing that I do quarterly helps me know, okay, if you're not getting better, what else do we need to be addressing to get you into a repair phase? And if you are doing better, great. How can we continue to up-level your health status? Because there is no maximum, right? Like we see professional athletes still training and improving and mile times getting faster. So there is no maximum, but the goal is to keep raising the bar and to close that gap between where they are and where they could be. And chiropractic plays a huge role because if the brain isn't communicating with their body, not much else is going to be very effective. Wellness is kind of all significantly limited if you leave out the chiropractic piece, because if you're not reconnecting brain and body, then your goal, your maximum point is lower than it should be. Chiropractic increases the potential that a person has to enhance their health. And so that heart rate variability test tells us, number one, is their body responding to the care that we're providing? But number two, what else do they need to be doing on their own at home to continue to allow their body to heal? And that parasympathetic piece is all vagus nerve.
Okay. So how does one find alignment in their vagus? How do we let the blood flow to the vagus nerve aside from getting chiropractic care on a normal basis? I mean, do you have any suggestions on that? Like, how do we stay in alignment once we've become aligned? Does that make sense?
Tell me what you mean by alignment.
Well, we're trying to find the best blood flow, right?
So blood flow is really an osteopathic type approach, but chiropractic directly enhances the parasympathetic nervous system. So there are adjustments that I do that will make people cry, that will make their palms all sweaty, that gives them goosebumps. That's a direct sign, outward sign that their parasympathetic system has been upregulated. Beyond that, like other ways you can indirectly affect the parasympathetic nervous system are things like do some meditation, eat proper food, get enough sleep. So all the things we already know to do, the self-care things are meant to help improve parasympathetic function, but to actually stimulate the vagus nerve, like physically, chiropractic adjustments, there's nothing else research-based, and I shouldn't even say it that way. We have not found anything to date that directly impacts the parasympathetic nervous system the way a chiropractic adjustment can.
Powerful.
Yeah.
How often do you think people should get chiropractic care?
Well, everybody's going to be different, and it depends on what their goals are. There is a lot of research that shows that even if you're getting adjusted once per month, that will impact parasympathetic function. You can measure that change with heart rate variability, but you can also measure it with white cell count. And this is really interesting. because the same research studies will also tell you that people who are getting adjusted once per month after 6 months have a 200% stronger immune system than the average person and a 400% stronger immune system than people who are chronically sick. So when we see people go from, I catch every cold, I catch every cough, my kids are bringing home everything and I'm constantly sick, to 6 months later from chiropractic care, they're like, oh yeah, I don't get sick anymore. Or I was sick for a day instead of 2 weeks. It completely transforms their body's immune response. But that also translates to the autoimmune response, right? So how many people do we have right now in this country that are battling autoimmune issues? Well, these things didn't exist 200, 300 years ago. Where did they come from? They came from environment largely. And so now we're doing all these negative things and we're eating chemicals and we're bathing in chemicals. And chemical overload is a real big problem. So you have to do enough healthy things to flip the scale in the other direction. And so paying attention to those small lifestyle habits make a really big difference in what a person's able to achieve when it comes to health status. But once a month after 6 months is showing to have those types of like laboratory value changes to show improved health status.
That is so profound. I have a question about the actual manipulations that you do. Do you find yourself doing manipulations more around the pelvic region or more around the cranial region, like the upper?
Oh, that'll change. Yeah, so that'll change for every person, and then it will depend on the technique that we're utilizing. So several different adjusting techniques that we use, and there are over 200 named techniques, but we focus on 2 or 3 primarily. Number one is a technique called torque release technique. And so specifically when you're talking about nerve function, because this is not an adjustment meant to push on spots that feel stuck, right? Like that's rudimentary. And I have people who come in and they're like, well, I pop my back because my kids walk on it. Well, that's not an adjustment. That's a manipulation. That's just forcing something to move for the sake of movement. That's not our goal with chiropractic, nor should it be with any chiropractor. Although I think some have kind of given clients what they think they're looking for, even though there's better available. But what we're trying to accomplish is how do we unwind that neurological tension so their brain can communicate with their body? The most profound places where we can do that are where we have neurology, like neurological tissue that attaches to structure. So that's going to happen at occiput, so base of the skull, C1, C2, little bit on C5, and not typically again till the sacrum. It's why also techniques like cranial-sacral are so powerful, not because of the bone that you're working on, but the neurological attachment. So if you think about your neurological system like guitar strings attach at the top and the bottom. The string has to have a very specific amount of tone or tension to vibrate at the right frequency and produce the right note. Well, nerve tissue works the same way. It attaches at the top and the bottom. And neurological tissue should have a vibrational frequency of 64 hertz, just like middle C on a keyboard. You can test that frequency with a tonal chiropractic technique. So I do a bunch of different reflex checks to figure out which string do I need to adjust, which segment, which direction, even clockwise or counterclockwise to work. And so it's not even a manipulation like you're forcing the body to move. Sure, we can do that if appropriate and makes sense for that client. But more importantly, how do we get their tone back? Tone and vibration are everything. Healthy food has a proper vibrational frequency. Every cell has a normal cellular vibration. And so all we're trying to achieve is establishing that normal, healthy vibration back. And then the body is capable of incredible things.
Oh my God, this is so cool. The tonal, this is freaking cool. Okay. Can you explain to people who don't know what craniosacral therapy is? Like, can you just explain that a little bit? Because I've had it done. It helped me heal from a car wreck. I think it's incredibly amazing. And I don't know a ton about it because it's not a technique that I perform, but I even have massage therapists who do craniosacral therapy. So craniosacral therapy is really focusing more on the flow of cerebral spinal fluid, and the pumps for cerebral spinal fluid are base of the skull and base of the sacrum. And so I often will check flow of cerebral spinal fluid on the table by watching. So as a person breathes, if they're laying down on their stomach, their head should rock backward and their sacrum should rock backward as they breathe in. And there should be a forward rocking mechanism as they exhale. So when it comes to specific craniosacral therapy, those are the things those therapists are focusing on, is that cerebral spinal flow and the pump of that fluid throughout the spinal cord. So a great healing technique. It's not really a chiropractic technique. It's more of a massage approach, but very beneficial. Yeah, highly suggest that people seek out their local cranial-sacral practitioner. I think it's a very powerful methodology that is not known enough for healing in a myriad of ways. First, okay, what are your thoughts, Stace, on adrenal fatigue?
Everybody has adrenal fatigue. We check B vitamins a lot in our functional medicine labs, and people's B vitamins are in the tank. Either it's number one, they're not consuming the right foods, or their GI system's a mess and they're not properly absorbing. So happens a lot.
So is that one of the reasons why you guys started doing IV nutrition?
Oh yeah, tons of people coming in for B vitamins when it comes to the IVs, and it's so fun what we do, because people like, they get results. And so it's so common for Sarah up at the front desk, she'll get a text message an hour after a person's left from an IV and they're like, the IV kicked in, I feel amazing. And so people notice that kind of stuff really frequently. The goal though there is, how can we keep this in their system on a regular basis? We don't want them to constantly need an IV boost just to feel human. We need to make sure that we're changing lifestyle and we're changing how their digestive system can absorb from the food that they are eating.
Yes.
But adrenal fatigue is like rampant. It's terrible.
It's just like everybody has it.
And vagal tone, quite frankly, for people over the last 2.5 years has been worse than I've ever seen it before. Thankfully, over the last 6 to 12 months, it's starting to creep back in a good direction again. But we do so many of these tests that you can see trends. And over the last 2.5 years, people's stress levels have just become more than what their physiology is typically prepared to handle, which is one of the reasons we offer all of the different services we do, because we need to find ways to make sure people can handle the stress in their lives. Some of it you can control and some of it you can't. So if you can't control it, you got to control what you can when it comes to your health and your wellness routines.
Right. So we know that wellness is something that we need to approach holistically. It's not just isolated, like you've said. There's, like we need to practice better sleep, do all the things. I basically am trying not to list them off because I want to ask you, like, what do you think and what do you see with your clients coming in? Like, what are they struggling with the most? Is it, are you seeing, lifestyle wise?
Yeah. So it kind of depends on the demographic. So we have a ton of women who, for the last unfortunate, generation or two, have been told to take birth control pills since the time they were 16 and having some discomfort. Right. And so we have this whole generation of women whose hormones are a complete disaster. Even to the point where people who are exercising well and eating really healthy and taking all their supplements still can't overcome the damage that's been done by some of that. Some of that has also come from chemicals on our food, like Monsanto is bad, GMOs are bad. Like, we keep getting told that these artificially created foods are going to be better for us. In a million years, the answer is no. But we're consuming chickens that have been fed estrogen. It's ridiculous what the average person, even when they think they're eating healthy, what they're consuming. And so for a lot of women right now, it's hormone imbalances, which also create mood imbalances. So women who are coming in on medications to help their hormones and medications to help their mood and not feeling like themselves and feeling like there's this screen between them and the world and that they don't even recognize themselves anymore. That's problematic. Like that's a generation of women that's going to affect the generation below. And we don't want that direction of health to be headed for our kids. I've got a 4-year-old. I know you've got a young son, same age. Like, we want to leave. We all say this, but I don't think in a single generation we've ever seen the mess that one single generation has created. And right now it's just glaringly obvious to me. So we see that a lot. We do see a lot of people who come in on blood pressure and cholesterol medications. This is more my male population. They were taught when they were young, they could eat whatever they wanted and it wouldn't affect them. Well, it's caught up to them. So blood pressure and cholesterol issues, a ton of diabetes, even for people who surprisingly who are not overweight. Like, you kind of expect that in people who've not been eating properly and are obese. But the number of cases of diabetes I see that we have to diagnose in women who you would never guess is startling. And it's because we've been trained to eat sugars. Like, people aren't getting the proteins they need and the healthy fats they need. And they're eating, even when they think they're eating healthy or gluten-free, they're eating junk food. And it's surprising how much high blood sugar that we see. The fun thing is we see that reverse with the programs that we utilize, which is great. Young kids right now, we see a lot of athletes. We see a lot of like Olympic professionals, world. We've got one guy that comes into the office who should have the world record in like some super lifting thing. I don't even know what it is. I just make sure his spine's taken care of. So we see a lot of different things, but those are the big trends right now. Or kids who are coming in that are like depressed, can't look you in the eye, and have been affected by these chemicals in our world for the last, well, for their whole lives, more than likely.
Yeah. Okay. Let's go back to the IV therapy. What are the benefits that you're finding, for the people that come through your guys' door, and what has it done for you?
Oh, so number one, so you probably see my little poll back here, because as soon as I'm done with this, she's coming in with another IV for me before I start my afternoon. But the one I love the most has B vitamins, a bunch of immune boosting supplements in there, and glutathione. I love the glutathione. It's a master detoxifier. And so while our family eats really well and we take all our supplements, I truly do all the things I tell my clients to do, or they wouldn't listen to me. But that glutathione, you feel that working and you just feel healthier. I also love the fact that it makes your skin glow, which is, just a nice side effect. So that's fantastic. That's the one that most of our clients come in and do. We also have a lot of people who are athletes. Like we have one hockey team that comes in and gets IVs in between hockey games on the weekends so that they can beat the team in the second game, even if they didn't the first. So great for hydration, but the B vitamins are huge, and the immune boosters are really huge right now. So we have people who come in, with cough, cold, and flu symptoms and whatever big, bad, ugly virus happens to be out there. We just hook them up on a high dose vitamin C and it kicks those symptoms right out.
I love it. Okay. And you guys just implemented salt therapy into your space. Tell me a little bit about that and why people would want to utilize that.
Well, it's just relaxing. Number one, it is good for your immune system. It does help with parasympathetic tone, which is all the amazing things that we talked about regularly. But the reason that we got interested in it right away is all the respiratory stuff that's been going around. It's great for your lungs. It helps clear that out. So people will bring their kids in who are kind of stuffy nosed and they're better by the afternoon. But great for inflammation. So we'll have people who go lay down in there and they've come into the chiropractic office for joint pain. We get them adjusted on their first evaluation day and want them to relax and make sure they get the most out of every adjustment, but especially as they're getting started. We'll put them in the salt room for 30 minutes and they walk out feeling different. You can see people's faces like not as inflamed and puffy 30 minutes later, which is a whole lot of fun.
I love it. Okay. So what do you think, Stace, is like the top lifestyle change that people need to make in order to start feeling better today? If you were to have to choose one, which I think is probably really hard, but
yeah.
What would you say?
You know what? Find a physician who will help minimize your medications. Cause I think they say the average American is taking 13 prescriptions. Well, I have 0. So somebody else out there is taking 26, right? So the way that we're using medicine to improve our health is a complete lie. Like medicines don't make you healthy. There's a time and a place and they can be life-saving for some people, but they're never going to improve your health. And so I think minimizing medications and not using that as a first line of treatment for symptoms is huge. And I think most people just don't. We've been taught to trust our doctor, but when all the doctor does is keep recommending more and more prescriptions, and now you've got a concoction of chemicals that you don't know how they work together in your body, it's a huge problem. I think sleep is a major issue. The number of people who get 4 or 5 hours of sleep a night because they're trying to overdo it is problematic. There's amazing studies on, if you get one night of not enough sleep, it affects you for up to a week. So think about how that accumulates if you're shorting yourself on sleep night after night. Eating the right foods, get rid of your, eat organic whenever you can. Like I wouldn't even let my daughter touch a regular banana. I know people think that we're crazy, but it's true, right? Like they inject latex into regular bananas, right? To make them stay yellow for a little bit longer. Yeah, I don't want my child eating latex. It's why they ask me allergic to bananas or balloons. They inject the balloon material into the banana. It's insane. And yet somehow this country allows it beyond my understanding. And so it's all of those things. And it's the accumulation though of all the little things. Like if you half the time eat organic and half the time get the right amount of sleep and half the time exercise, think about how much further that gets you than if you didn't. It's the little things that accumulate to make a big, big difference.
100%, 1% better every day.
That's right.
magnificent when you look back at your life a year from now. You will be like, wow, you know, just taking imperfect action. So switch out whatever, the gross burrito for the bean burrito, like whatever it needs to be, like one little step at a time can be super powerful. Okay, Stace, I want to just ask you, like, what are your top tips? What do you think that if you were to just have a message, if you were to be put on a stage right now, and you could say your message to the world, what would it be? And then we're going to wrap it up with 2 final questions.
So your nervous system controls everything that happens in your body. So it's so imperative to have your nervous system checked by a chiropractor who understands neurology and not just joint pain, because everything else you're trying to do will be so much less effective if you're missing that really crucial piece. You could be exercising regularly, but if your brain can't tell your heart how to properly pump blood, then maybe you're not getting the oxygenation you need. Like, everything happens from your nervous system. It controls everything. It's why when people start chiropractic care, all the things, you know, the number of people who come in and they're like, I'm trying everything. I'm doing it all. I'm eating, I'm exercising. And then they start chiropractic care and they're like, how is it suddenly that all those things are now working? Well, they would have worked before, but your brain and your body didn't know how to process that. And that's the key missing piece for so many people, because we know what we should be eating. It's just a matter of, are we doing it or not, right? We know we should be exercising. It's just a matter if you're doing it or not. But most people don't understand how important that nervous system piece is. And it's a huge piece that if they're missing will limit the potential they have in every other category.
So powerful. What does holistic living mean to you?
That's a great question.
We can come back to that one because that one's usually the very last question that I ask everybody.
Okay. You're going to give me a minute to think about it.
I'll give you a minute to think about it because I'm going to give you the opportunity to tell me about your thoughts on supplements, because I know that you are, you love your supplements. So tell me what are your top 2 supplements that you
top 2? Well, always an omega. Like, if you're not getting omega, your brain isn't fueled properly. So that's really important. Oh my gosh, to pick 2?
I know you have one more.
You should see okay. So this is my lunch supplements, like right here. Can you see those?
Okay.
Can you really close? See, now I'm spilling them. N-acetylcysteine, because we need a lot of detoxification. So N-acetylcysteine is your glutathione precursor. By the way, if you put this on YouTube, they're going to shut this off because they don't like either one of those words because of how powerful those supplements are right now. So
I'm too small. They won't take it.
Okay.
Oh my gosh.
On large accounts, you will get banned for saying N-acetylcysteine and glutathione. They're trying to keep those off.
Say it louder.
Say it loud and clear.
Well, let's talk about, just by the way, let's going back to the salt room. In your lungs. Did you know that broccoli sprouts can actually pull benzene out of your lungs?
Yes, I did.
Isn't that crazy?
It's really insane. And so that's the piece people are missing, is that they think that they're eating this just for vitamins. There are so many things that these plants are medicine. Like
100%.
That's what they're here for. Like, we need to be utilizing these more regularly.
I just got done interviewing Dr. T. Colin Campbell, and I was like, oh my gosh. But when he was in China learning all about the things that he learned about, he learned so much about herbs and all of the medicinal things. And he is a huge believer in that. And you're right. Plants are medicine 100%. We could
they absolutely are. Yeah. So I love supplements. I wish we could get what we needed from food sources. A lot of the food sources, like even the ground that an organic food is grown in, has been depleted of nutrients and minerals. And so, the best place always to get your vitamins and minerals is from food. I think most of our population is limited in their ability to do that, even with a really great effort. What we do in our practice, there are some basics that every human needs for their body to work well, and we'll recommend those basics. And then beyond that, we always make nutritional recommendations based on lab work. Like, let's see what your body really needs. And it's not just, do you fall in this normal range? It's, are you functionally optimal? And that's why so many people get frustrated with their traditional doctors, is the doctor looks at their labs and they're like, yep, everything looks good. Or inside, this person's like, I'm not good. Like, there's something wrong. Well, it's because these normal ranges are so wide, and where a person really belongs is in such a narrow scope. that unless you have someone who can read those labs through that lens, you're going to keep feeling the rest of your life like it's all in your head because people keep being told nothing's wrong, you're fine, you're fine. It's because they haven't found somebody who can, with great value, interpret those labs and give appropriate recommendations. So while I do love supplements, it doesn't mean everyone needs to take everything. The goal is just to truly figure out what each person needs to help rebalance, and then teach them the foods to eat to hopefully keep those at those healthy levels rather than relying on supplementation. So it's not a replacement for healthy eating in any way. It's just meant to help boost a person to where they need to be to get into that healing and repair phase, and then see how they can holistically take care of it from there.
I love it. So speaking of holistic, what does it mean to you?
You know what? I think it's just incorporating all aspects of your life into your lifestyle. So if I was eating really well and sleeping really well, but my finances were a mess, that's not holistic living, right? There is no such thing as balance, but rather a recognition that every aspect of your life impacts every other. And so you can't compartmentalize these things into boxes, like we were talking about before we jumped on the recording. You can't separate your financial life from your health. If your financial life is struggling, your sympathetic nervous system is going crazy, and you can't heal and repair. You can't have it both ways. And so paying attention to your healthy relationships, paying attention to your business life. Are you happy with the work that you're doing? Like, are you doing what you were put here to be doing? All of those things feed each other. And when you find that holistic balance that feeds your soul, then you can be nothing but successful.
I love it. So good, Stace. Oh my gosh, your wealth of knowledge. And we want to make sure that people follow you, especially people that are local, but even people that are non-local. We will have all of Staci's and Life Refines brand links in the show notes so that you can stay in touch with them and utilize their services and learn from them. So thank you so much. Do you have any final thoughts you want to share?
No, thanks. We need to find a reason to get on a Zoom every once in a while more often.
I know.
I think we've worked on this for a while.
We're gonna have to come back and talk about entrepreneurship, because that's the whole thing that I think, again, it's part of holistic living. It literally, we want to help people make more money, because when you make more money, you can change the world. So we'll leave it at that.
What somebody once told me, you can't help the poor by being one of them. So get yourself out of that cycle. And sometimes people have this, like, they think that's a badge of honor, this sacrifice piece, but there are better ways to do that.
Oh, boom. I love it. Okay. My friend, thank you so much.
Okay.
You're the best. We'll talk soon.
Good to see you.